And we want to give you an update on what's happening across the state of Georgia now. We will go to Governor Brian Kemp, who's speaking right now to update us on the COVID-19 situation. Let's listen in.
Others who have embraced this call to action, thank you. Your leadership and hard work are flattening the curve and keeping people out of harm's way. Up until this point, I have implemented several targeted measures to slow the spread of coronavirus and protect vulnerable populations. Through the March 31st, elementary, secondary, and post-secondary schools remain closed. Where feasible, some school systems have moved to online learning, and I certainly want to applaud the local leaders for finding ways to keep our students engaged. I also want to thank the nutritionists, bus drivers, and volunteers who are packing and delivering school lunches to students all across our state. On March 12th, I directed state agencies to implement teleworking policies. Aside from the most critical government services, most state employees are now working from home. I've also restricted visitation at certain state-run health facilities, correctional facilities, and juvenile justice centers, except in end-of-life circumstances. On March 14, 2020, I declared a public health state of emergency to deploy additional resources and give the Department of Public Health authority to direct specific healthcare action in our fight against the spread of COVID-19. As part of this state of emergency, I have authorized new processes for temporary licensure of out-of-state doctors and nurses. And I have authorized the Georgia Emergency Management and Homeland Security Agency to coordinate with the Georgia National Guard to call up as many as 2,000 troops to assist in the emergency response if needed. Last Friday, I signed 2 additional executive orders, one authorizing nearly $20 million in emergency funding to pay for necessary medical supplies, and the other reducing regulations, especially in the healthcare context to address COVID-19. All Georgia licensed pharmacists are now permitted to dispense a 90-day supply of a prescription drug if a patient has no remaining refills and the pharmacist cannot get in contact with the prescribing provider. Pharmacists may also dispense early refills for prescription drugs. I would note that these authorizations do not apply to Schedule II controlled substances. In addition, the Board of Pharmacy is now empowered to grant temporary licenses to out-of-state pharmacists, and I have lifted certain restrictions on the expansion of healthcare facilities, new services, and expenditures. These measures will positively impact our healthcare infrastructure by removing regulatory red tape as we expedite projects to address patients' needs. Among other provisions, the order lifts requirements for in-person corporate shareholder meetings, allows Georgians to utilize private providers to comply with state minimum standard codes for building inspections and similar structures, and allows the Department of Community Health to waive regulations which would otherwise hinder our capabilities in responding to this crisis. Through the Department of Revenue, I have decided to extend Georgia's tax filing deadline to July 15, 2020, in accordance with the new federal tax filing deadline. We will be issuing more guidance on this change in the days ahead. On March 12, 2020, the Department of Public Health notified cooperating agencies within the state about the activation of our strategic national stockpile. Accordingly, the department submitted a request to the Strategic National Resources, or for Strategic National Resources, to federal officials to support the state's COVID-19 response. On March 13, 2020, our state's multi-agency task force, comprised of officials from Public Health, Emergency Management and Homeland Security, the Forestry Commission, the Georgia State Patrol, Natural Resources, the Department of Defense, the Technical College System of Georgia, the University System of Georgia, and local supporting agencies stood up our Strategic National Stockpile Warehouse of personal protective equipment. The task force started distributing 18 packages of state-owned PPE to each of our state's 18 public health districts to support local health care providers as well as county health departments. Over the weekend, we distributed 268,200 N95 surgical masks to all 142 hospitals across the state. Earlier today, we also distributed 30 ventilators to two of our hardest hit counties, Dougherty and Floyd. On March 16, 2020, the federal government's first delivery of PPE began arriving at the state's warehouse. To date, we have executed 3 scheduled resupplies to our 142 hospitals, 18 public health districts, affected long-term care facilities, and medical emergency providers in all 159 counties. We have shipped out 532,170 N95 masks, 65,640 face shields, 640,600 surgical masks, 46,700 surgical gowns, 635,000 gloves, and 64 pallets of general hospital supplies. According to the U.S. Health and Human Services, Georgia will receive a second delivery of PPE within the next 5 days. GEMA has placed an order for respirators, which are scheduled to be delivered to the state's warehouse this Friday. GEMA continues to place orders for supplies and resources to support frontline health care providers as well as first responders. Right now, one of our biggest challenges in our state is the healthcare capacity, especially in hot spots that we have. For example, in Dougherty County, we currently have 64 cases with 6 deaths from COVID-19. Capacity is becoming an acute problem for Phoebe Putney Memorial Hospital. Several hospitals are facing potential bed space shortages and supply issues. To address these problems, we have identified multiple options to bolster capacity. For example, in Dougherty County, emergency management officials are working to reopen Phoebe North, which is currently closed but will offer at least 26 rooms for patients once we get it back up and running. In Albany, we have identified an additional facility with capacity for roughly 60 medical and isolation beds if they are needed. In addition, we have asked federal officials to allow us to keep the temporary medical facility at Dobbins Air Reserve Base once cruise ship passengers depart. We are hopeful that we will have this location for the metro area for patient diversion. It will offer roughly 200 patients beds if needed. At the Georgia Public Safety Training Center, we have completed construction of an isolation zone to hold as many as 20 emergency housing units, and the campus offers as many as 242 dorm rooms that we could use for potential patient surge in the future. Earlier today, Vice President Pence called on governors to inventory all of our outpatient surgical centers to determine the potential for bed space. This process has already begun here in our state with the Department of Community Health, and we will continue to work on that and report back to our federal counterparts once we have those numbers finalized. As part of this initiative, we urge healthcare providers to consider counseling elective procedures to preserve medical supplies and to free up resources, including workers as well as treatment space. So far, we have identified nearly 600 additional beds beyond what our hospitals currently offer, but our work there is far from over. Right now, the state is exploring projects with the Army Corps of Engineers for arena space in large buildings, and we are considering the conversion of vacant and underutilized properties of all types for hospital space. The Georgia National Guard is standing up teams to support regional coordinating hospitals, and the first team will embed for training with Grady Health System within the next 48 hours. In addition, the Georgia Department of Defense is working with the Georgia Medical Reserve Corps to administratively attach to the State Defense Force, which is comprised of volunteer workers to assist in emergencies. To bolster our responsiveness, Georgia has also signed a statewide contract with Healthcare Workforce Logistics to deploy clinical staff during any patient surge. To support Georgia's ability to receive timely, effective care, on March 9th, Insurance and Fire Safety Commissioner John King issued a directive to insurance companies to ensure telemedicine and telehealth options be covered at the same rate as regular in-person care. Over the past few weeks, we have seen a large increase in the number of applications submitted for the Supplemental Nutrition Assistance Program, or SNAP. Last week alone, the Division of Family and Children Services received nearly 12,000 online applications. That's up from 6,400 applications of 2 weeks ago. These numbers do not include the paper applications. Requests for medical assistance such as Peach Care for Kids and Medicaid have also increased. Last week, applications for medical assistance increased by 50%. Without question, our families are facing hardship in this time of need. State officials are working on plans to support the nutritional needs of its most vulnerable residents, allowing families who participate in the Supplemental Nutrition Assistance Food Program to access the maximum benefit amount for their household in March and April. Right now, the average monthly SNAP benefit per Georgia household is $225. About $200 million in SNAP benefits is distributed to Georgians every month. This supplement will allow them to get the maximum benefit amount for their household size, which is $194 for a household of one in March and April. In March and April, approximately 1 million Georgians who receive SNAP will get an additional $100 in nutritional benefits. This change will be a major support to senior citizens in our state who typically receive about $15 in SNAP benefits each month. This supplement will allow for them to get the maximum benefit for their household size, which is $194 for a household of one in March and April. State officials are also working with the U.S. Department of Agriculture to issue increased supplement for March as soon as possible. March benefits have already been issued, so the supplement will come in the form of a second allotment at the end of the month. This supplement will be included as part of the regular monthly benefit in April. To assist in other areas, the state is reassigning staff and working with federal partners to address the sudden increase in requests for public assistance as quickly as possible. We will continue to provide updates as we identify these solutions for our constituents. Today, I will be issuing an executive order requiring the Department of Public Health to require certain individuals with an increased risk of complications from COVID-19 to isolate, quarantine, or shelter in place. At a minimum, this order for isolation, quarantine, or shelter in place covers those who are living in long-term care facilities, have chronic lung disease, are undergoing cancer treatment, have a positive COVID-19 test, are suspected to have a COVID-19 because of their symptoms and exposure, or have been exposed to someone who has COVID-19. The Department of Public Health will promulgate rules and regulations to implement this order and define how these individuals can access essential services, travel, and receive visitors if there's an end-of-life circumstance. This order will also close all bars and nightclubs, and it will ban all gatherings of 10 or more people unless you can maintain 6 feet between people at all times. The Department of Public Health will the Department of Public Health will be empowered to close any business or establishment, nonprofit, or organization for noncompliance. These measures were developed using guidance from the Centers for Disease Control and Prevention, and the Georgia Department of Public Health. This order will go in effect at 12 noon tomorrow and will expire at 12 noon on Monday, April the 6th, 2020. These measures are intended to ensure the health and safety of Georgians across our state, and I would ask for everyone's cooperation over the next 2 weeks. They will protect the medically fragile, mitigate potential exposure in public venues, and allow the state to ramp up emergency preparedness efforts as cases increase in each region. Additionally, I will sign an executive order today suspending restrictions against the practice of medicine by individuals whose licenses became inactive or lapsed within the past 5 years. Graduate nurses who have yet to take up their nursing exam will also be allowed to seek temporary licensure through the Georgia Board of Nursing. These measures will directly address critical health care needs in the weeks ahead. Today, I, along with 21 governors, signed a letter to Senate Majority Leader Mitch McConnell, House Speaker Nancy Pelosi, Senate Minority Leader Chuck Schumer, and House Minority Leader Kevin McCarthy to request new block grant funding for states to fight COVID-19. Governors across the country are on the front lines of this fight, and many of us are spending heavily at the end of the budget year, facing a significant decline in economic activity during this crisis. We desperately need these resources, and I look forward to working with our federal counterparts in the days and weeks ahead. This fight is far from over, but we are in this fight together. Look out for your fellow Georgians and pray for their continued safety, as well as the safety of our first responders, healthcare workers, the elderly, and the medically fragile. Please continue to follow the guidance of healthcare professionals by using best practices, regular hand washing, social distancing, and disinfecting frequently used areas to prevent infection. While we have taken strategic direct action today, I am calling on my fellow citizens to fight this virus with everything you got. We are all part of this solution. If your friends, neighbors, or local organizations are not complying, call them out or report them to us. If any establishment isn't following these directives, I would ask you to take your business somewhere else. We cannot let this virus defeat us. We are stronger than this crisis, and we will weather this storm. Thank you. May God bless you, and may God continue to bless this great state of Georgia. Good evening.
That is Governor Brian Kemp wrapping up his press briefing on COVID-19, giving us an idea of where we stand now with this disease here in the state of Georgia. Governor Kemp saying we cannot allow COVID-19 to defeat us. We're all in this together. We have to fight this virus. We're all in this together. One of the key takeaways toward the end of his press briefing was the emergency order that he will soon be signing, and it will require that long-term health facilities, those in long-term health care facilities, shelter in place, and anyone who has a positive COVID-19 test to shelter in place. He says this order also applies to bars and nightclubs. The bars and nightclubs will have to close also gatherings of 10 people unless you can stand 6 feet apart. You don't need to be together. That's basically what the governor is saying. This emergency order, again, from Governor Brian Kemp, will close all bars and nightclubs. It will go into effect 12 noon tomorrow until 12 noon on April the 6th. And again, that order requires shelter in place for people living in extended or long-term health care facilities and anyone who has been diagnosed or has a positive COVID-19 test. That's one of the major takeaways from Governor Kemp's press briefing just a few minutes ago. And I just want to also mention this as well. The governor says they're working very hard to make sure that we get the supplies that we need here to take care of people. He says GEMA will place an order for respirators. Actually, that's happened, and those respirators should be in by Friday. Of course, we will have a full wrap on WSAV.com of what the governor has said in this press briefing today as it relates to COVID-19 and the coronavirus.